It is Monday. So glad you're with us. You're watching HLN Now. I'm Susan Hendricks, and we've got a whole lot to talk about.
Yeah, we have a lot to talk about. I'm Yasmin V, and we start today with Ebola, which is trending on Facebook. What you're searching specifically is about quarantines. 3 states, New York, New Jersey, and Illinois, have mandatory quarantine for healthcare workers coming from West Africa. But New York's governor is saying the 21-day quarantine can now happen at home. One American nurse, Casey Hickox, was forced into quarantine in New Jersey, and she was not happy about it.
To make me stay for 21 days, to not be with my family, to put me through this emotional and physical stress is completely unacceptable.
All right, as of this morning, Casey has been allowed to return home to Maine. Now, in New York, a 5-year-old is being tested for Ebola. He has a fever and recently traveled to West Africa. We'll keep you posted on the results of his test. So everyone has an opinion about this quarantine order. Some of you weighed in on our Facebook page, and 94% of you say everyone, not just healthcare workers, everyone coming from West Africa should be quarantined for 21 days. All right, Dr. Devi joins me now. She's assistant professor at NYU School of Medicine. Dr. Devi, what is your reaction to this poll that I just talked about, where 94% of people are saying everyone should be quarantined?
I'm not sure if everyone should be quarantined, but I definitely think that the healthcare workers should be quarantined. Now, it's not a perfect solution. Obviously, you're infringing on people's individual liberties, but we have to think about the public. I mean, if we even look at West Africa, one of the biggest problems they've had in managing Ebola itself is that they didn't have the public support. I mean, at that time, those folks were labeled as superstitious and stuff, but they were really very concerned about what the healthcare workers were doing. So I think we need to take the public's concerns seriously.
Right, yeah, because a lot of people are very fearful at the moment. So it's our job to quell their fears, right? All right, let's look at all the cases of Ebola in the United States so far. So I have a map. Let's bring that map in right now. All right, up first, we had Dr. Kent Brantley. We all remember Dr. Kent Brantley, and Dr. Nancy Ripeal as well. They were both treated here at Emory University Hospital. And then we had an unknown guy who wanted to be anonymous, and he has since been released from Emory Hospital. We have Rick Sacra. He's also a physician. He was being treated in Chicago. Ashoko Mukpo, you guys remember him as the NBC freelancer. We have Nina Pham and Amber Vincent, who both contracted Ebola from Thomas Duncan, who, of course, you knew flew in from West Africa. And then, of course, the most recent diagnosis was of Dr. Craig Spencer. So, Dr. Devi, what do you think about that? Dr. Craig Spencer is now being quarantined. Do you think that in all the travels that he did throughout the time that he was in New York, people should be fearful of contracting Ebola?
No, so I think there's a big distinction to be made. I mean, he did not have symptoms when he was traveling around the city, so I don't want people to be afraid about that. You have to have symptoms in order to be contagious. But the thing to learn from his case is that, what if he wasn't as vigilant? What if he wasn't checking his temperature multiple times a day? Right. It would be pretty easy for somebody to get into the subway system or, be able to travel in the city. And then what would happen? Ebola could spread not just in New York City, but think about all the people that come in and out of New York City, both from the rest of the country and internationally. So, these healthcare workers, obviously they don't believe they have Ebola, right? Otherwise they wouldn't take these risks. So that's why something has to be in place, because it's hard to tell if someone's been exposed or not, at least in West Africa.
Right, but we also have to all admit that they are being heroes by going to West Africa and treating the disease there. So Dr. Devi, let's go through what it is that Dr. Craig Spencer actually did. So up first, he went for a run. They say he went for a 3-mile run. We're not sure where he went for a run. So in that case, let's say he was running in the park. We all sweat.
Yeah.
And say if you're running by him or you're running next to him, any chance that you would get Ebola?
No, I mean, let's look at evidence, too, because, it's easy to come up with these theoretical situations where it's hard to know. But if you look at the evidence, let's look at Thomas Eric Duncan. He traveled on a plane. He went around. He even went to the ER when he was contagious, when he was having symptoms. And, he was near other patients. He was near his family in his home where they presumably had, closer contact. But none of them developed Ebola. So it seems like it's very hard to get. But it is easier to get as you're sicker, maybe when you have more vomiting, when you have more diarrhea, more blood exposure. So if someone was just jogging next to him in the park, I don't think they're at any risk, even if he was sweating.
And we're going to talk about Thomas Eric Duncan's case in 1 second. So he also took the subway, right? I think he took the A line. I think he took the L line. The L line goes to Williamsburg, which is where he went bowling. So he took that subway. So say you're on the subway next to him, right? And maybe you're sitting in the chair next to him. You're holding on to the ring. He's sweating. Any chance you'd get Ebola?
No, because if he wasn't having symptoms, you won't get it. And even just sweat touching you, it has to get into your actual body fluids, too. The virus has to get into you. So that would be very hard to do in that circumstance. And just as a New Yorker myself, I can say there are a lot of other things you have to worry about in the subway, but I don't think people should worry about Ebola right now.
Yeah, I'm from New York as well, and I sure know that. There's a lot of other things we should probably be worrying about. All right, and then finally bowling. So we went bowling in Williamsburg, Brooklyn. I love Williamsburg. That's actually my hood. So Williamsburg, Brooklyn, you put your finger in the bowling ball, right? Say you use that bowling ball after him. Any chance you'd get Ebola there?
Probably not. Again, he didn't have any symptoms at that time, so you wouldn't really worry about that. I mean, you know, and the other thing is he was well enough to go bowling. So you're really thinking about people who are much sicker. Now, with just going back to the quarantine, I mean, these folks are not sick, but at the same time, I think, you know, this is more to appease the public, like for their concerns, as opposed to really preventing people from being contagious and getting Ebola out there. But I think it's just a balancing act there.
All right, so you talked about Thomas Eric Duncan before, right? Ultimately, the people that had the disease passed on to them within the United States were healthcare workers that were treating Thomas Eric Duncan. And so what we imagined was he was treating them. There may have been vomit. There may have been blood passed on. And they may have not been covered up. We've heard from various nurses that you know, worked alongside these other nurses like Nina Pham that they didn't have the proper procedure or the proper clothing in place. So ultimately, how is it that that disease may have passed on to these healthcare workers?
Well, so there are a couple different things. So let's say, I mean, usually people have more problems when they are taking off this equipment, you know, or this gear. So let's say that somebody had stuff on their gloves. Now, I mean, I've seen this just because we follow these types of protocols, not the exact same thing, but just going into the operating room and getting out of the operating room. Let's say that you have some blood or something on your gloves. You know, you're trying to get your shoe cover or something off from around your foot, right? You might stabilize yourself. You might put your arm out and lean against the wall or something like that. Now you have bodily fluids maybe on the wall. The next person comes, maybe they take their gloves off first and they touch the wall. So now they have it on them and they can, you know, potentially touch their eyes or touch their face. Plus with vomiting and diarrhea, you know, it wasn't mandatory for people to wear those scrub hats, the things that they wear to hold their hair. Let's say something got into your hair and then you're touching your hair, playing with your hair and touching your eyes. Now, again, they're in a different situation because he was critically ill. He was in the ICU, so it's a little bit different.
And that's when his symptoms were at the most. And just to be clear as well, so everybody out there knows, the family members that spent time with Thomas Eric Duncan before he went into the hospital, none of them have tested positive for Ebola. And I think
none of them.
It's very, you know, I think it's very important that we all keep that clear. All right, Dr. Devi, thank you so much for joining us.